Happy New Year and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is on your health. Not only will we discuss the coronavirus vaccine that has everyone's attention right now, but we'll start things off talking about the importance of getting your flu shot. As many as 45 million Americans are affected by the flu each year. It spreads year round, but is most active between November and April. African Americans and Latinos are harder hit by the flu every year, and this in part is because of a lack of trust or confidence in our healthcare system. Here to discuss that and the Be an Influencer Education and Awareness campaign is Dr. Kevin Izard from Paladina Health, and he is a Medical College of Wisconsin alumnus and received his Bachelor of Science degree from Marquette University. How are you, Dr. Izard?
Hello, how are you doing?
I'm doing very
Uh,
well, and I
yeah,
certainly appreciate you being here. The
yeah,
flu is, of course, caused by influenza viruses, which get passed around every year, with some years worse than others. Is it too
right.
soon in the flu season to know how this year is looking as the COVID-19 pandemic rages on?
Okay. I would say this year, like so many other things this year, it's been unprecedented. And one of the things that's different this year than usual is that because people are wearing masks and distancing, not everybody, but a number of people are, we're not seeing the big peak that we usually see in the flu. So the flu is spread in the same way as you would spread COVID-19. So
Mhm.
if you're wearing a mask, distancing yourself, washing your hands, you shouldn't get either one of them. So and that's one of the reasons why we really want to get this campaign really to try to push for flu shots. People don't have access yet to the COVID-19 vaccine, but they do have the flu vaccine. That's been around for a while. It's been proven to be safe and it's readily available. And if we can take that off the table, it'll make things a whole lot easier because people are getting sick. Someone calls me, I can't tell from the symptoms whether it's the flu, or whether it's COVID-19. And so if we can eliminate the flu, that would make things a lot easier and take some of the burden off of our emergency departments and hospitals and things.
Yeah, wow. It makes a lot of sense. And just like
Mhm.
even some of the symptoms of the common cold, you don't know if it's
Right,
COVID or a cold.
right,
So it
right.
makes it kind of stressful, but
Uh-huh.
you're here for that reason today, like you
Right.
said, to kind of check one of those things off so you can feel at least secure in that
Hmm.
sense. The Wisconsin Department of Health Services has launched the Be an Influencer Education and Awareness campaign to help promote flu vaccination among African Americans and Hispanics. But tell us more about this campaign and why it's directed at this specific group.
Okay. I remember early on when COVID first started back in March of last year, there was a big myth going around the African American community that Black people couldn't get COVID.
I
And
remember.
that's because initially we weren't seeing a whole lot of numbers and there weren't a whole lot of cases in Africa. And so people made the jump and say, oh, Black people can't get this. Well, we know how that ended up. I mean, it wasn't very long before we started seeing a spike in cases with an African American community. And that was, in fact, interestingly enough, Wisconsin was one of those first places where we started to notice that because of the way we had to collect our demographics. We were able to see that African Americans, we were able to tell by location too, where those spikes were. And so we really did a better job of detecting who and where the virus was. And so we started to see that. And then as that information got out, other communities start to notice, yeah, our African Americans are more likely to get it. And we're more likely not only to get it, but more likely to have complications from it. And so um, that that is one of the big reasons why we've been really pushing for African Americans to get tested for COVID and to get access to the COVID vaccine, which is another conversation. Right now, the flu, we are actually not surprisingly more likely to have complications from flu also,
Mhm.
and it's probably from a variety of reasons. African Americans are more likely to have high blood pressure, more likely to have heart disease, more likely to have kidney disease. And those are all things that kind of put you at an increased risk for having complications, lung disease, asthma,
Yeah.
all those things make you more likely to have complications. And so whether it's COVID or whether it's influenza, we do tend to have a higher incidence of complications and death from flu or COVID. And on top of that, we're less likely to get the vaccine. And that's why I got involved with the influencer program. Is we really want to get the word out, in African American community, and not only get the word out, but I think a lot of people have mistrust of the system.
Oh yeah.
And yeah, and the thought was, if you can get somebody who's African American, who people can trust, and hopefully people trust me. I have a trustful face, I hope. Um, yeah, and
Yeah.
and,
So
yeah,
you're
but
serving as a spokesperson to
right,
really drive home the point of the importance of getting this vaccination, and people can
right,
find out more, or they will see more about this campaign on social media, which includes Facebook, Twitter,
right, right.
Instagram, YouTube, Snapchat. The list goes on, but radio and television as well. And they also have ads that are being presented to the masses in Spanish. So
Yes, yes.
I guess it's important to pinpoint, and this is something people hear every year, but I think it's important to reiterate who should get the flu shot and maybe
Hmm.
who shouldn't.
Yeah. Basically, everybody should get the flu shot. If you're above 6 months old, you should get a flu shot. That includes kids,
Mhm.
especially the elderly, because they're more prone to, again, because of them being older, and immune systems being more likely to be compromised, they're more likely to have complications. Um, but everybody should get a flu shot, especially this year, because we want to take the flu off the table as we deal with COVID. There is another vaccine for people that are high risk and elderly, where it's a higher dose. It's because their immune system doesn't always respond as well to the regular flu dosage. And then the dosage for kids is a lower dosage than the one for adults. But really across the board, everyone should consider getting a flu shot.
So people with chronic health disease should also
Yes.
definitely do that.
Yes,
Okay.
especially there are a lot of people out there who have asthma, or maybe even other lung diseases like from COPD, from smoking and things. If you're a smoker, definitely get a flu shot. If you have asthma, definitely get a flu shot. If you have any of those comorbid things we talked about, high blood pressure, diabetes, kidney disease, definitely get your flu shot.
And there are a number of places around the city that actually offer free flu shots. So
Yes, yes, yeah. You can just walk in and get one. So, and then you don't have to worry about paying for it. Insurances will cover it. The state will cover it. So, again, we're really serious about trying to make sure people have access to this.
yeah, and I'll tell people to call 211 to find out where maybe they can get some free flu shots. So that's always a good resource. So let me play devil's advocate with you for just
Okay.
1 second, because I know you've heard this as a doctor, because
Hmm.
I have heard this. Every time I get the flu shot, I get sick.
Hmm.
But when I don't get the flu shot, I'm fine. What do you say,
Right.
doctor?
I knew you were going to ask that question, because that is the most common reason why people say they don't get the flu shot.
Absolutely.
One, now also, there's this myth, that Black people don't get the flu, but
That's
that's a myth
crazy.
like anything else. Right, exactly. Um, usually when people get the flu shot, it's during the cold and flu season. So, it's November, December, January. The cold's going around already, and it just so happens that you get your flu shot a week later, you get a cold. It wasn't the shot that caused it. You were going to get that anyway. So a lot of times it's just coincidence that you get sick. There are a few people that truly have allergies to flu, that flu vaccine, I should say. We always caution people that have egg allergies, to be cautious with it. Um, but for the most part, both the vast majority of people, the most you're going to get is maybe your arm will be sore for a couple of days. Maybe you might get a low grade fever, the night after the shot, but that's about the extent of it. It's not going to give you the flu. And anyone who's truly had the flu, it is nowhere near like the symptoms you get after getting the flu vaccine. People,
Yeah.
the story I hear when people have the flu, they say, I'll get a call saying, Doc, I was at work yesterday, and at 3 o'clock, I felt like a truck hit me. I just felt terrible. I went home, I got into bed, and I can't even get up today. That's the flu.
Mm.
It's body aches, it's it's like a cold on steroids. You just feel terrible. You got body aches. You got low grade fever. Uh, Interestingly enough, it's not the GI stuff. A lot of times we call like stomach flu. Stomach flu truly isn't. It's not really flu. Stomach flu is another virus. When we're talking about flu, we're talking about influenza, the respiratory virus.
Right. So, one thing that I thought was interesting, I was doing some reading. Dr. Ala Stanford, she's a board certified surgeon and founder of the Philadelphia based Black Doctors COVID Consortium. She said, quote,
Hmm.
we have to stop saying that Black people don't trust the healthcare system. It is that the healthcare system has been untrustworthy to African Americans. There's a difference, and that's the history. So I
Hmm.
bring that out because so many times we've heard in the news people say, oh, the minority community doesn't trust the healthcare system. And
Hmm.
a lot of people who don't know history or certain parts of history are not aware of things like the Tuskegee experiment and
Hmm.
things of that nature. So there is a mindset that has been passed on generationally where people
Right.
don't trust vaccines and shots and things of this nature. What do you say
Uh-huh.
to those people, knowing that that exists,
Hmm.
about, really saying, basically, I think it's a toss up. You're going to have to figure out, are you better off getting it or not? And that goes for the flu and COVID-19. So give us
Right.
your thoughts on that as we wrap up, Doctor.
Yeah. I for historical reasons that you mentioned, there does tend to be mistrust. And in addition to that, though, it's not just historical issues. It's the issue like when you go to the doctor, is the doctor a person you can identify with? So
Mm,
if that person doesn't look like you, you're less likely to think, well, their experience or their recommendations are really going to apply to me. A lot of us really, traditionally we listen to maybe your grandmother. If your grandmother says, well, baby, you don't need that, you're not going to get the shot. And so so we tend to be we tend to move in different circles a lot of times. And again, that's another reason for the campaign to try to hit things differently. The things that have worked in the past for the majority culture might not necessarily work for us. And so we're trying to find different ways to reach people. Maybe it's through social media, maybe it's through word of mouth, maybe it's through using influencers. And so we're trying to do things in a different way. But yeah, it's very true. Now, whether you want to say that we're mistrustful or the system has failed us, I think they're probably both true. The system really hasn't helped us out, especially when you look at issues of access. Maybe you can't get in to see a doctor because of your insurance, because you have Badger Care, and the doctor you want to go to or the one who's nearby doesn't take Badger Care, or they're full and they only take a certain number of people, or any number of reasons. Things like, okay, you say that they might say you can come in a certain time. Well, maybe you got to work at that time, or maybe you don't have transportation, so you can't get across town and go to Freighter to get your shot because you got to take 3 buses to get there, and the buses are limited as far as how many people can ride it, and you got to take your kids off from work or from school, or if they're in school. Or you can't leave the kids at home because they're at home and you have to be there with them, or you have to work. You can't miss work again. So there's a whole lot of other social issues, barriers that get in the way of us doing something as simple as coming to the clinic and get a flu shot. And
wow.
so, hopefully by having, different sites where people can go, different hours that are more convenient for you, we can hit people where they are.
Well, I thank you for all of your time today in
You're
helping
welcome.
break this down and really just giving important information that is going to make a difference in the lives of so many people. I
Hmm.
appreciate everything that you've given us today.
Yeah. And if I can say one last thing, to all you viewers out there, if you haven't gotten a flu shot, please go ahead and get one. It's really, and I tell my patients, call me if you get sick. Cause people say I get sick. And I said, well, call me if you get sick this time. I talk them into it. And rarely has anyone ever called me and said that, I got sick from the flu shot. So a lot of it is just you hear from other people that say, yeah, I got a flu shot and I got sick. So you say, well, I don't want one. But it's really not, not as bad as you think. It doesn't really, the needle's very small, it really doesn't hurt. And again, especially this year, because of COVID, we want to really make sure that we take flu off the table.
All right. Well, thank you again. It has been a pleasure talking to you.
You're welcome. Thank you. Have a good day. Stay safe.
Yes, you do the same. Dr. Kevin Izard is a physician at Paladina Health, and he's a spokesperson for the Be an Influencer campaign. For more information on anything we've discussed, you can visit dhs.wisconsin.gov/influencer. When we return to Our Issues Milwaukee, we'll switch our conversation to the COVID-19 vaccine and how some are leery of that vaccine. We'll talk to Dr. Tito Izard from Milwaukee Health Services Incorporated right after this.